Now, what can be done? Like, what can the average person do? I see people walking around with masks on, wearing gloves. Is that nonsense?
Largely, yes.
Yeah.
First of all, let's step back. The primary mechanism for transmission is just the respiratory route. It's just breathing. In studies in Germany, which just have been published literally in the last 24 hours, they actually followed a group of people who had been exposed to somebody in an automobile manufacturing plant. And then they had 9 people that, with this exposure, he said, if you have any symptoms at all, contact us. We want to follow up. And they all agreed. Well, they got infected. And so in the very first hours, just feeling bad, sore throat, they went in and sampled their throats, their saliva, their nose for virus. They did blood, they did stool, they did urine. And they found that at that very moment, when they first got sick, they had incredibly high levels of virus, sometimes 10,000 times that we saw with SARS, in their throats, meaning they were infectious at that point already, and they hadn't even had symptoms yet of really any nature. They weren't coughing yet.
Wow.
And that's where we're concerned, because that's the kind of transmission. It's, I always have said, trying to stop influenza virus transmission like trying to stop the wind. We've never had anything successfully do that other than vaccine, and we don't have a vaccine here. So what's happening is that people in public spaces are getting infected. And the way you need to address that is, unfortunately, if you're older, over 55, you have some underlying health problems, which unfortunately a lot of Americans do. We have obesity. Then right now you don't want to be in large public spaces. You're trying to potentially get infected. So you can take care of that part. As far as what can public health do, we can talk about this. We're not going to have a vaccine anytime soon. That's happy talk. We can close schools. One of the big challenges we have right now, if we close schools, what do we accomplish? In influenza virus, when we close schools during outbreaks, because it turns out kids get infected in school and they're like little virus reactors. They come home and they transmit it to mom and dad and brothers and sisters. And so we close schools sometimes. And Christmas breaks are always great for kind of putting the dampening effect on flu. In this case, kids are not getting sick very often at all, which is one of the really good news features of this disease. In China, only 2.1% of the cases were under 19 years of age. And,
why is that?
We don't completely know. And I'm going to come to that in a second, because they're getting infected, it turns out. One study showed that they still get infected with the virus, but they don't get sick. And we have that happen. There's a disease called infectious hepatitis A, where we have outbreaks in daycares. And the way we know we have an outbreak is because it's transmitted through the stool, fecal oral, is mom and dad and the daycare providers all get sick.